Hey everybody, this is Dr. Jim, and I'm here to talk with Compounding Corner Pharmacy about COVID-19 in one of many talks that I give on COVID-19. And today we're going to talk about some supplements for COVID-19. And just to remember, this doesn't replace going to your doctor. Getting information is great, but you still have to be treated professionally. So Shannon, thank you for spending a few minutes with us today. How are you today?
No, I'm good. Thanks for the invite. Always a pleasure.
So your pharmacy, what's the name of it and where is it?
Compounding Corner Pharmacy, and we're in Sugar Land, Texas.
Right, right. So what kind of supplements do you have? We talked a little bit about supplements for prevention infection. What type of supplements do you have right now that are useful for COVID-19 that you recommend?
Okay, so there's a lot out there and a lot of information. It's a little confusing. I do think what is more accepted at this point is obviously going to be zinc. Zinc is what gets inside the cell and stops the replication or slows it down. There's a lot of forms of zinc out there. The ones that we're going with is zinc picolinate. It's a 30 milligram capsule. You can do that once or twice a day. Zinc, you do have to be careful. You can take too much zinc. It will actually depress your immune system if you overdo it. Beyond zinc, vitamin D is the other thing that you can use. Some of the recommendations are as low as 1,000 IUs a day. I don't think that's quite enough. I think more the standard of care right now is 5,000 a day. Or because it's fat soluble, you could do that literally once a week. So 50,000 once a week is also viable. Other than that, you want to increase your immune system. Antioxidants are well established. There's a lot of use of vitamin C right now. You can do up to 50 grams a day. They see that in IV for severe cases, even in cancer or whatnot. But orally, typically 1,000 or 2,000 twice a day is going to work well. There's a lot of information about quercetinase. Quercetinase is a product by Thorne that has quercetin and bromelain. The quercetin is going to help increase the absorption of zinc into the cell. Zinc does not readily pass through the cell wall into the cell. You can also do things to decrease the issues regarding the clotting is a problem right now. So thinning the blood is helpful. Thinning the blood can be done by any antioxidant like vitamin C. Fish oil is a great idea. There are other antioxidants like grapeseed extract, green tea extract. Those are perfectly viable in combination as well. N-acetylcysteine, it helps thin the mucus. That's very helpful as well.
Can I stop you for a second, even though you're doing a great job, because you've talked about so many different things and I wanted to comment on them as you were going. One thing that I've learned recently is that vitamin D is excellent. You could take up to 10,000 IUs, but you should also consider vitamin A deficiency. So before you start taking vitamin D, you have to look at the vitamin A levels. That's really important. And of course, if you had any kind of thinning problem, blood thinning problem, like your platelets are low, you have to be careful with taking too much vitamin C or too much omega-3s. So those are just a couple of the things that we were talking about. And the things that you talked about were primarily for prevention and in the infection stage. Some things you can take later on for the inflammation stage. So there has to be a good balance between the two. You have to know when to start and when to stop products. Go ahead, I'll let you continue. Sorry to interrupt you.
By all means. So you touched on some of the items that could be used at the beginning. There's a lot of mushroom derivatives and herbal remedies. Phytogen is something made by Thorne Research. It has echinacea and astragalus and schisandra and some of these other mushroom extracts. Like you mentioned at the beginning,
right,
if you were trying to boost your immune system, at some point, if you started having obvious symptoms, a severe cough, difficulty breathing, that may actually work against you because
if you have the inflammation, right?
Agreed. Other than that, you also have to consider, your as you mentioned, primary defenses here are going to be prevention. So wearing a mask is going to be ideal. Social distancing is going to be ideal. There are different levels of filtration. You can have just a surgical mask, which is going to help basically prevent you from infecting other people. N95 masks, you got 95% filtration. You can go all the way up to CBRN masks, which will protect you and everyone. Everything from you. You can still infect others with a CBRN mask, but still it will protect you from everything. Also, you have to consider your risk factors. If you have diabetes too and it's uncontrolled, if you're type A blood type, if you have hyperplatelets on your labs, if you're male, if you're elderly, there's a lot of risk factors that can put you in a different category there.
Right. Yeah, we've been talking about that a lot. You seem very well equipped as a pharmacist. You know about everything, not just about the supplements, which is great. Obviously, we do need to take precautions. And, the Sweden experiment has failed. Not wearing a mask, not doing social distancing is definitely going to increase your risk of getting COVID-19 and spreading it to others, which is not what we want to do. Some of the other things that you mentioned, again, taking astragalus root and things like that are very good for prevention and infection, but they will actually, I want to reiterate that point, they will actually aggravate inflammation. And a lot of people don't know that. Echinacea, a lot of people take echinacea every day of their life. So that's really important. There's different levels. There's a prevention part, there's an infection part, there's an inflammation and recovery. And then, of course, there's another section now, long-term consequences, what products to take later on, which we haven't really discussed today. Anything else you want to add?
I'd like to on, this has been going on for 4, 5, 6 months now. Here in the US, it's really been more of an issue since late February. As time goes on, I think people tend to get desensitized and they don't realize that the risk is still there. And you have to consider that the media hypes things, and there's some truth to that. But this is still a very serious event to consider. If you look at the numbers, people, you talk to me about how people equate this to a bad virus flu season. And there is a difference here. Keep in mind, if you look worldwide, since the advent of this, there's over 500,000 confirmed deaths. Right. In the United States, there's over 120,000 confirmed deaths. If you look at the confirmed infection rate, we have 350 million people in the United States almost, and yet there's only 2.5 million confirmed cases. So, history teaches us, the Spanish flu of 1919, this is probably going to come back with a roar this winter. And people have to remember, yes, we're going to get herd immunity, but not yet. Yes, we're going to get a vaccine, but not yet.
Well, we don't really know how things are going to go. We do know that we have to go by the best scientific information that we have. It's not a political issue for me. It's more protecting people, protecting others, protecting ourselves. And we don't really know how things are going to ferret out in the end. Nobody knows the answer to that. But like you said, it's pretty bad so far. And that second wave will probably come November, December, and we'll get the flu and we'll get the COVID-19, and it will be confusing to people. But I just wanted to give people a few things that they could do on their own with the input of their physician. I say that because even these supplements have some risk. Would you agree with me? The potential risk?
I do.
Yeah. So if people want to find out more about purchasing, they can go to Compound Corner Pharmacy, and you're in Sugar Land, right? What's the best way to reach you?
Well, we have everything. There are a lot of supplements out there. And so if you want to get it from us, we'd love the business, sure. But you can find that online on our website, www.compoundingcornerpharmacy.com. I will touch on supplementation. You do need to take that with a grain of salt. Remember, over the counter, there's no regulation. So nothing is really verified for purity or potency. So in short, you get what you pay for. We do tend to favor Thorne Research. I'm a big fan of theirs. There's nothing wrong with Metagenics. I'm a big fan of theirs as well. Douglas Laboratories, Pure Encapsulations, a step down, but at least still somewhat verified, is if you go to Whole Foods or some place that has a lot of organic.
Right. And also, Shannon, for your benefit, for others out there, you also are a certified compounding pharmacy. So you have a lot of experience putting the drugs together, right? Correct?
We do. I mean, that's our business. We are a problem-solving pharmacy. We generate and make medications on a daily basis.
So what makes you think, because people will think, why should I spend more money on Thorne when I can get something a lot cheaper, somewhere else? Instead of paying $40, I can pay $10, $15 and go somewhere, like HEB and get something a lot cheaper.
Sure. No, absolutely. So it doesn't mean that the products at HEB aren't good. You have to look at the manufacturer and see if they have information posted for third-party validation of purity and potency. A lot of studies have been done over the counter where Consumer Reports and other similar groups have pulled products off the shelf, and they've done an analysis of the ingredients by GC Mass Spec and found that many of the companies out there have subpotent or even zero potency. And then you have to consider allergies. You have people that have issues with wheat and gluten, soy, dairy, milk, nuts. So you have to look at the constituents for the non-active ingredients as well. But again, you can verify it yourself, but you want a company that's third-party validated for purity and potency.
Thank you very much. My last question, looking behind you, you're also a medicine shop? Are those some of the products that you used to sell? You don't look that old.
No, those are not for sale. That's part of my collection. I love antiquity. I love the roots of pharmacy, and so anytime I get a chance, I will acquire a piece of history. So all that's on display, and people like to look at it while they're waiting for their prescriptions.
Thank you very much. Have a wonderful day and stay safe, Shannon.
I appreciate the invite. Thanks for sharing the information.
Thank you.
All right, Dr. Weiss.
Be well.
Yes, sir.